Hello, my name is Nancy, and I'm going to present my patient to you. She is 14 years old, and I chose her from my clinical rotations at the pediatrician that I'm working with at this time. I chose this patient because she was there with her mother, but the reason why this patient was meaningful to me was because I felt like I could help. I think that was the biggest thing. I did my assessment, I did everything I was supposed to do with the patient, and my preceptor, this was the first patient that he actually let me go in pretty much by myself and then come back to him and go over the plan, the differential diagnoses, similar to what we did when we were tested on the patient. Okay, so again, my patient is 14 years old, and she came in for a well child check with her mother. So the chief complaint is a well wild check, and that is basically HPI. She doesn't have anything significant as her past medical history, medical problems, no surgical or hospitalizations. Her immunizations are up to date, seasonal allergies, and she only takes her Zyrtex as needed for allergies. I'm going to highlight the things in my SOAP note that led me to my differential diagnoses. She has pertinent family history. Her maternal grandmother is a type 2 diabetic. Her father is obese and he's a pre-diabetic. And her paternal grandfather has heart disease. I use the acronym HEADSS to do my social history. The patient lives at home with her parents, her mom and dad, and 2 siblings, a brother and a sister. She feels safe at home. She has a family pet, a dog. There's no guns in the home. And then her education, she's in the 7th grade. She's in a hybrid program where she goes to school twice a week, and then the other 3 days she's at home. She's doing good in school. She's been at this school for her 2nd year. Her favorite subjects are English and math. Her least favorite are social studies. Reports getting A's and B's, and patient has not decided what she wants to do after high school. For activities and employment, she is not employed at this time. She likes to read and text with her friends. Due to COVID, she hasn't been able to really get together with her friends, which is contributing to one of my diagnoses. She's also not exercising at this time or involved in any school activities. Regarding her dietary habits, patient states she doesn't like vegetables, eats very little for breakfast, sometimes skips meals. She doesn't drink enough water, reports only drinking 50 ounces of water per day, drinks 1 can of soda per day. She would like to be more active and lose some weight. She denies using diet pills or laxatives to lose weight. She also denies use of alcohol, drugs, or tobacco products, and doesn't have any friends that are using as well. On her PHQ-9 score, scale, she scored 8, which is considered mild depression. Regarding the last S in HEDIS, patient denies having a romantic relationship at this time, denies being sexually abused. Her mom wasn't in the room when I asked her the last couple of questions in this evaluation. Her review of symptoms, the pertinent positives are she's feeling tired and motivated most days of the week. And that's about it. She does report feeling somewhat depressed and doesn't really feel anxious. Those were the pertinent positives. Her vital signs were normal except for her BMI, which is 38.41. That obesity will be one of my diagnoses. She weighs 203 pounds and she's only 5'1". So there's no labs that were already ordered, so I'm ordering what was ordered was, which was my idea, which is an A1C, TSH, and a T4. So physical exam positive pertinents are not very much. She's pretty healthy otherwise, aside from her being overweight. So my differentials are well child check, of course, obesity, mild depression, and encounter for screening for diabetes mellitus. Okay, so the reason I chose diabetes mellitus is because number one, she's overweight. She's also Hispanic, which I didn't mention, and she has family history of diabetes as well. So that's why I chose that. Obesity, obviously, because she is, and then the mild depressions was based on the PHQ-9 and her own and some of the things that she contributed in her answers to my questions. So for the so I won't go over the plan for child check because obviously that'll just be yearly. But for her obesity, the diagnostics was obtaining her weight and height for the BMI. For the treatment, I ordered a dietary consult. In addition, I talked to her and her mother about walking 4 to 5 times a week just to get moving because she hasn't been doing any activities. And then try to think of a recreational activity that she might like, that she might enjoy and would be able to do during this time. Because she doesn't eat vegetables, I just asked her to think of vegetables she might want to try that she's never tried before that she might like. And then instead of regular soda, diet soda, which I know isn't that good for you, but it would be better than what she's doing now, and maybe we could change from diet soda to then carbonated water and possibly just water. We talked about the dietary consult to be prepared and have questions ready to ask. We talked about how to keep track of water intake and taking daily weights or weekly weights once she starts this program. For mild depression, I also encouraged individual or family counseling. I stressed her the importance of continuing to speak to her mom and dad about how she's feeling. And for the diabetes, after I would get the results of the test, the A1C, at that point I could make a plan for her, as well as if her TSH or her T4 is also positive. Obviously, lifestyle changes and activity would be number one, whether or not she's diabetic. If her results is anywhere between 6.5 to 7.4, a lifestyle modification can be used for 3 to 6 weeks to see if that brings her A1C down. If it does not, metformin is the first pharmaceutical choice for diabetes. Overall, I just wanted to say that the thing that I think I contributed to her mom and the patient feeling comfortable with me is having a caring attitude, looking at him in the eye, and asking questions that were questions of concern, and the education that I gave was, based of concern. So I think they felt comfortable with me, and I think if I was a real provider, they would have enjoyed working with me based on their feedback and how they reacted to what I had to say. Thank you for listening.